Hi everyone, this is Harshita. Welcome to Teddy Guides channel. So today in this video, we are going to discuss an important topic, that is nephrotic syndrome. In the last classes, I dealt everything about the nephrotic syndrome and the introduction to the renal system. If you not watched the video, please go back and watch the videos and make sure that you are very clear with that two topics. So now let's start with the nephrotic syndrome. The only difference between the nephrotic syndrome and the nephritic syndrome is proteinuria. The amount of the proteins that are secreted by the urine are different. For example, in nephritic syndrome, there will be presence of proteinuria, but which is less than 3.5 gram per 24 hours or day. But whereas in nephrotic syndrome, there will be presence of proteinuria, but which is greater than 3.5 grams per 24 hours. So this is the one major difference. In nephrotic syndrome, you can observe massive proteinuria. And the second one is edema. This is also an important topic to remember. Edema is present both in the nephrotic syndrome and nephrotic syndrome. But in nephrotic syndrome, it is present generalized edema, whereas in nephrotic syndrome, it will be periorbital edema. So to remember this, in nephrotic you are having O here, and in periorbital you will have O. Okay, so periorbital edema is most common, and patient also have hypercholesteremia and also dilution coagulopathies. So these are the clinical features, and urine examination also shows peculiar points. So urine examination, as the proteins are very high in the urine, you can see frothy urine, because in that urine you can see more amount of lipids or fatty cast. So you may be worried that what is these cast. I dealt about cast in the first video of renal diseases. Please go back and watch the video. Okay. Now let's go deep into this nephritic syndrome. This nephritic syndrome is of 3 types. And these 3 types will depend on the age of the patient. For example, in children, in adult, and the next one is elder people. In children, you can observe minimal change disease, whereas in adult you can observe focal segmental glomerulonephritis, glomerulosclerosis, and in elder people you can mostly observe membranous nephropathy. So these are the different types of diseases that you can see in the nephrotic syndrome. So let's start with the minimal change disease. Minimal change disease. So the first point is age. Mostly 2 to 6 years of children are getting affected because of this minimal change disease, and it is also called as nil deposit disease or lipoid nephrosis. Or morphology. So in light microscopy, the glomerulus will be normal. Glomeruli will be normal. You can only observe lipid depositions in the tubules. And these lipids are also can be seen in the urine. Hence, the urine is frothy in nature. Okay. And the next one is electron microscopy. This electron microscopy is very special here, because in this you can see effacement of podocytes. Let's extract the image from the Robbins. So this is the image related to the electron microscopy. Okay. So this is the normal image and this is the epithelial cells, food processes, detachment and effacement. So let's know the reason for this effacement. Because of some of the toxins or some cytokines or any epithelial cell antigens. So there will be effacement and detachment of the epithelial food processes. So because of these, the proteins will get escaped and excreted through the urine. So because of this effacement of the epithelial food processes, the proteinuria content or the protein content in the urine will be greater than 3.5. Okay, so this is the reason for getting more proteins in the urine in a patient who is suffering nephrotic syndrome. I hope you are clear up to now. And the next one is immunofluorescence. In this immunofluorescence, you will find no deposits here. So this is the reason that this is called as nil deposit disease. And the next important point is treatment. So at the end of the day, you have to treat the patient and you have to make him happy. So steroids will respond well here. And the next one is focal segmental glomerulosclerosis. Focal segmental glomerulosclerosis. We already discussed here that this we already discussed here that this disease is more prone to adults. The reason for this disease is unknown or idiopathic. But you will have secondary causes for these diseases. So these secondary causes may be hypertension, HIV, heroin abuse, or some of the reflex nephropathy, renal ablation surgery, or sickle cell anemia, and IgA nephropathy. The last one is obesity. So these will be the reasons for getting focal segmental glomerulosclerosis. And as usual, let's talk about the morphology. In this morphology, you will see light microscopy, observations, electron microscopy, and immunofluorescence. In the first class, I discussed if you get the name focal, less than 50% of the glomerulus is getting affected. Or if you see diffused, greater than 50% of the glomerulus will get affected. Okay. So this is called as focal. Less than 50% of the glomeruli will get affected in the focal segmental glomerulosclerosis. And in electron microscopy, this is the image given in the Robbins. In this you can observe only 50% of the glomerulus is getting affected here. Okay. So this is the image directly taken from your Robbins. You can observe here too only 50% is getting affected. And the next one is electron microscopy. In electron microscopy, same as the minimal change disease, here also you can find there will be effacement of the podocytes, because of which there will be passage of proteins into the tubules and they come out through the urine. Effacement of epithelial podocyte food. In immunofluorescence, you can observe depositions of IgG and C3 proteins. IgG and C3 in the sclerotic area. So these are the points you must remember here. Now let's move into the third disease, that is membranous nephropathy. As we discussed earlier, this was majorly seen in the elderly people. Okay. The causes are different for this disease. First one is, you can see this one in malignancy of colon, pancreas and lung. You can also see in infections like hepatitis, syphilis, malaria and schistosomiasis. And some drugs also can cause this membranous nephropathy. They are like gold and penicillamine. And some autoimmune diseases like SLE and renal vein thrombosis. So these are the causes that are given in the Robbins that are capable of forming membranous nephropathy. Now let's move into the pathogenesis. In pathogenesis, there are 2 points that you must remember. First one is, it is immune complex mediated. Immune complex mediated. And the second one is phospholipase CA2. There will be defect in the phospholipase CA2. So this is the pathogenesis that you can observe in the membranous nephropathy. And now let's move into the morphology. In morphology, as usual, you can see the images of the immunofluorescence electron microscopy and light microscopy. First, let's move into the light microscopy. So this is the image that you can observe in the light microscopy. Okay. So now let me decode the important points from this image. Here you can observe thickening of the basement membrane. So basement membrane, so this is the arrow. There will be thickening of the basement membrane or diffuse thickening of the capillary walls. Diffuse thickening of capillary walls. And in the silver stain, you can observe spike and dome appearance. These spikes are nothing but the basement membrane, and dome is nothing but the immune complexes. So let me draw a diagram for you. For example, these spikes are the basement membrane, and these are the immune complex depositions. So these are the important points that one must remember in the immunofluorescence of the membranous nephropathy. Then now let's move into the electron microscopy. So this is the image that you can observe in the electron microscopy. Here there will be electron dense depositions along the epithelial side of the basement membrane. So here you can observe, these are the arrows which shows subepithelial depositions. So these are the findings you observe in the electron microscopy. In immunofluorescence, you may observe either the granular depositions or the linear depositions. Here you can see granular depositions. So these are the granular depositions that you can see in the immunofluorescence of the membranous nephropathy. Okay, So this is all about the membranous nephropathy. Now let's move into the membranoproliferative glomerulonephritis. Membranoproliferative glomerulonephritis. So this disease is also called as mesangiocapillary glomerulonephritis. Mesangiocapillary glomerulonephritis. Okay. So this disease shows both nephritic syndrome and nephrotic syndrome, but nephrotic is the major one. So all the features of the nephrotic syndrome you can observe here. Okay. This is divided into two types. First one is type 1. Second one is type 2, which is also called as dense deposit disease. Dense deposit disease. Okay. So now let's learn about the first one, that is type 1 membranoproliferative glomerulonephritis. It is immune complex deposition. So here you can observe immune complex depositions, and sometimes complement is also sometimes deposited. Whereas in type 2 you can observe activation of complement pathway. So these are the important points that you must remember here. Now let's move into the microscopy, where we will discuss about the electron microscopy. So this is the light microscope image. So here you can observe tram track appearance. Tram tract appearance. So the immune complexes and the complement depots split the basement membrane into two. So you can see here, because of the proliferation, mesangial cell proliferation, there will be increased mesangial matrix and the basement membrane thickening with segmental splitting can be seen. There will be thickening of the basement membrane and the segmental splitting can be observed here. Swelling of the cells can be seen, which lines the peripheral capillaries. So let me write it here. Because of immune complexes and complement system, the basement membrane divides into two. You can observe this here. There will be division of the membrane. And you can also see hypercellularity here. There will be swelling of the cells which line the capillary walls. Hypercellularity. So these are the observations of the light microscopy. Now let's discuss about the electron microscopy. Here in the electron microscopy, you can observe two types. Like we discussed, like type 1 and type 2, right? In the type 1 you can see subepithelial deposits. Subepithelial deposits. You can observe them here. Whereas in the type 2, you can observe dense deposits. So these are the things that you can observe in the electron microscopy. Now let's move into the immunofluorescence, which is very easy. Let me write it here. Immunofluorescence. In immunofluorescence, in type 1 and type 2. In type 1 you can see granular pattern. Whereas in the type 2 you can see linear one or ribbon like. So these are the observations that you can find in the membranoproliferative glomerulonephritis. So this is all for today. If you are not yet subscribed to the channel, please consider subscribing to the channel to educate you. This is K. Harshita signing off. Thank you so much.